Exams and sign up. I think that's what everybody's talking about these days. Stay tuned. Hello ladies and gentlemen, my name is Reza Roudsari. I'm the Director of Undergraduate Education at the School of Dentistry, University of Manchester, and thanks a lot for joining me on another episode of Manchester Molars. Now, before I proceed with this episode, I want to remind you about 3 little items. First of all, when you come into the dental hospital, please make sure that you gel your hand and also put your surgical mask on. And don't forget to keep your surgical mask on everywhere in the dental hospital, including the changing area, please. Number 2, make sure you are compliant with your social distancing and definitely you're not overcrowding our rooms. If you're going to have your lunch and there is not enough room in the student common room, the university place, the Silver Can building, is now open to all of you guys, so you can go there and enjoy your personal space. And 3, please do not come to the dental hospital in your tunics or a scrub, and certainly do not leave the hospital in work uniform. Your tunics, a scrub or work clothes have to be put in a plastic bag, sealed, and as soon as you get home you put them in the wash. Recently I sent BDS Year 5 their identity data, and as expected we got a couple of emails with queries. So who better than Dixon, our assessment lead, to answer some of these common themes and questions. So please come and join me on an interview with Carly. Hi Carly, thanks a lot for coming on Manchester Molar. How are you today?
Good, thanks. How are you?
I'm very well, thanks. Now, so we sent the data which we had on identity for our final year students out, and we got a number of emails. I thought we'd take this opportunity to just cover some of the common themes of those emails, so then everybody knows where we're standing. So the biggest question is molar endo.
Yes. So in terms of the competencies, there are 2 types of competencies: single rooted endo, so that might be an incisor, or it might be a premolar that might have 2 canals, and then there's the molar endo, which is called 3 roots or more. So it's real clear differentiation between the 2. So what the single write-up for a molar endo needs to be separate to those of premolars. They can't be utilised for the molar endo write-up.
Thank you. And they were worried that obviously we don't have that many molar endo patients at the moment on the list, and they may not get signed up. Is this the case?
So this is a national problem for molar endo. So I want the students not to worry too much about this, and we're putting lots of steps in place to make sure we can try and get as many opportunities for the students. So if you have a molar endo, brilliant. If not, then we've got a list of students that are looking for them. And then, as Reza said, we're looking at local general practices that we can liaise with to be able to get those experiences. But if you've not done a molar endo for sign up, it doesn't mean that you won't be signed up just based on that alone. So that's really important not to worry about.
That's right, Carly. And as you just said, it is a national problem. It's not unique to us. And this is not a problem of this year either. We always have got problem of getting good molar endo cases. What I've done is I've spoken to the restorative lead, Dr. Joan Conliffe, and normally the GDPs, when they refer to us, there is quite a long waiting list before the patients can be seen on consult, but we need the patients now. We can't wait. So therefore, she's kindly creating a pathway whereby if a molar endo is easy enough for undergrad training, then they tick a box, it gets triaged completely separately to the normal patients. So we're trying to streamline getting those patients in ASAP. So that's quite reassuring, isn't it? What happens if students have not finished the requirements prior to the sign-up date, which is only in March, and that's quite early? Do they not get signed up?
So this happens every year. So obviously we set the date in March, and it allows us to kind of stop the clock, look where students are, and then as we've been doing preemptively, doing that targeted training. So at the sign-up data, we'll be looking at across the collection of the board of how that student's engaged. So we would expect all the relatively straightforward competencies or milestones to be submitted, so the observed ones and the written ones. There might be some that might be outstanding, such as molar endo, or if they're completing dentures or indirects that might not be finished, and that's okay. So those students in those places would be signed up with the requirement that they would need to complete those prior to graduation, so that hopefully would be able to complete those before their exams. If not, like we've done in previous years, Reza, we've sometimes had some students that come back after their exams to work specifically on those targets to make sure that they're well-rounded before they're graduating.
Exactly that. So just to reassure everybody, the sign up is for us to also identify who needs more support, so we can try to provide them with those extra sessions, extra patients where possible. So it's not uncommon for some of the students to come back even after their exams, try to finish their clinical competencies, which is perfectly fine. We're here to support them and help them. Now, so exam dates. We haven't moved exam dates just simply because of the jobs. And as far as we know, still there is no firm decision whether they're going to be twin takes for foundation dentistry. So we're still going with the same deadline as every other year, which we had. However, what I'm wary is the exams this year are slightly different to last year's. Do you want to tell us a little bit about that as well, please?
Yeah, so the exams, comparing to last year, so obviously we removed the MCQ paper, so that's the same as last year, and we're just having the short answer paper for the students. So that will be completed online with Blackboard. As students were aware last year, they didn't complete their medicine and surgery components of their OSCEs, and what we've been working with is to have those as questions related in the short answer paper. So medicine and surgery related to dentistry, so it's not going to be a specific medical question, but it's how does that patient's medical condition relate to their dental care and management. So that's the written component, and then for the unseen components in its traditional terms, we're going to do 3 cases, because we know that you can't provide a case that you've done previously, so there'll be 1 case on oral surgery and oral medicine, 1 case on paediatrics and orthodontics, and 1 restorative case. So you'll have an exam over 3 days and 3 exams concentrating on each of those individual disciplines. They'll all be done online, so they'll be remote, and the examiners will be remote, and that worked quite well last time, and we got quite good feedback from the students. So again, hopefully kind of minimise disruption for students having to come in to sit those exams.
That's correct. That's very helpful to know. Finally, you want to tell students a little bit about oral surgery as well. What's the news?
So we had a few questions about oral surgery numbers, and what we've been doing this year and with Professor Yates is looking at those students that have had no experience this year and making sure that they're going to additional sessions. But on the sign-up data that was sent out, they'll notice that we were looking at 10 extractions in year 5, and we had some students that were worried. They've, for example, extracted 25 teeth, but they haven't done 10 this year. And what we were going to reassure them is that we're looking overall, and ideally we'd like all students to have taken out 10 teeth this year. So you're up and ready for foundation year, so you'll have that confidence built up. And we are concentrating on working through students to hopefully throughout the rest of this year that they'll be able to have that experience. So you don't need to do a mad rush. We're well aware of the students that have had limited experience, and we're targeting those first and then kind of working our way through. And Prof Yates, a really big thank you, because he's been looking for additional sessions to support students as well. So that's been really helpful from his side of things.
Thanks, Scarlett. That's very helpful. So just to reassure everybody, the data we sent out is for information only, and that's not only for students' information, but also for us to be able to help them and support them and try to make them competent and confident dentists in readiness for their foundation year. Is there anything else you would like to say about the exams?
Just that the exams are the first week of June, so with the exam board on the Friday. So the exams are likely to take place on the Tuesday, Wednesday and Thursday, and the exam board on the Friday. So we'll have a full lecture about all the exams and kind of a mock experience, so the students be well prepared of what they're going to see on the day.
Very good. To be honest, as an examiner, I'm looking forward to it. Last year it was a very successful and enjoyable session, so I'm sure this year is going to be the same. But thanks a lot for coming to Manchester Molar, and I will see you later at the dental hospital.
Bye now.
Bye.
So recently I told you guys that we are moving the patient waiting list online, so you can have access to this list on demand wherever you want on the clinics. You'll be pleased to know that this is now done. So we moved 700 patients to this list, but those 700 patients have not been validated. So now we are in the process of contacting all those patients to make sure that, first of all, they're genuinely still on the waiting list and they're waiting to be seen, and second, they would love to come and have their treatment done at the dental hospital. So once this is validated, which is a 2-week project, then we will tell you where you can go and find these lists, and then you can help yourself to the patients from the list. So with that said, we have reached the end of Manchester Molars for this week. Until next week, I've been Reza Roudsari. You've been amazing, and bye-bye.